is Louise Hill. I am a paediatric doctor and researcher working within the Centre for Neonatal and Paediatric Infection at St George's University of London. And my main involvement with SNIP-AFRICA is with the NeoSep1 trial. So the NeoSep1 trial is a large clinical trial that is going to be carried out in around 10 low and middle income countries around the world, including several neonatal units in sub-Saharan Africa. The target population are babies that have been admitted to neonatal units and who have become unwell and are thought to have an infection and so need to be treated for that infection. The reason that we are doing this study is because babies are a group that are at increased risk of getting infections and they can become unwell very quickly. Serious infections in babies can be caused by many different bacteria or bugs, and we don't necessarily know which bug is causing the infection when we have to start treatment. In some cases, the bugs that are causing infections now in babies are changing and they're not responding in the same way to antibiotics that we would usually give them to treat these infections. So they're becoming what we call resistant to these antibiotics. The antibiotics that are currently recommended by the World Health Organization in many cases now don't treat these infections that are being caused by these resistant bugs. Previous work that we have done has shown that actually using some older antibiotics might be a good option for treating babies with infections, and particularly if we use two of these older antibiotics together or in combination. What we're aiming to do in this study is to look at comparing the currently recommended World Health Organization antibiotics with these older antibiotic combinations, but then also to compare these to antibiotics that are commonly used on neonatal units around the world. We will tailor the trial to the antibiotics that are used locally. So we've had really in-depth conversations with the local teams to really try to ensure that the trial fits with their local practice, so that when we try to implement the results of the trial, it's really applicable to people who are treating babies with infections in sub-Saharan Africa. So current World Health Organization guidelines have not been updated in many years, and what we really hope is to produce information that will lead to the better treatment of babies with sepsis, because this is an area that really is lacking in information. And what we would aim is that the results of the study would potentially inform local, national or World Health Organization guidelines dependent on what we find.